Good evening. My name is Robert Porter. I'm the Chief of Police for the Downers Grove Police Department. I wanted to thank everybody for coming out tonight as we talk about a very tough topic. I know the weather is tough out there, and I really appreciate everybody fighting the weather and coming out here and joining us for our forum tonight. We're looking at this as an opportunity to engage our community on an issue that we think is very, very serious from a public safety standpoint. And we wanted to, we invited some speakers that had a lot of background on the topic and the subject matter. We want this to be a two-way dialogue between our public and our law enforcement officials. Right now, what we're seeing, not only in Downers Grove, but in communities across the state, is an alarming increase in the use of heroin. We're seeing it not only in the crimes that are being committed by people trying to support their habit, but we're also seeing an increase in overdose deaths, and also medical situations where our paramedics have actually had to save people that have had experienced an overdose situation. This is not unique to Downers Grove. This is happening in communities all across the state. And any community that thinks they're immune from this problem needs to take another look, because it's there, and you need to address it head on, which is exactly what we're doing here in Downers Grove. This past year, we've lost 4 young people as a result of heroin overdoses in our community. These deaths have occurred not only in public places, but also in private dwellings as well. Several months ago, our detectives had to break the very sad news to a parent who had just lost his son to a heroin overdose. Any of us who were present that day in the police facility and listened to the anguish of a parent who was just told that their son is not coming home, I know it has made an everlasting impression on all of us. I know in the 25 years that I've been a police officer for the Village of Downers Grove, I've seen a lot, I've heard a lot, but that particular day I will never forget of hearing that parent that had just lost a loved one. And it's one of the main reasons why we're here today. We want to do whatever we can here in Downers Grove to prevent another incident like that. And we can't solve this problem alone in law enforcement. We need the help of the community. We need the help of parents. Talk to your kids. This issue that we're talking about, heroin, is a very dangerous and powerful drug. It's not like any other drug. Once you try it, you could become addicted, and it changes your life forever. So we're here to make a statement. You're going to hear story after story tonight about the significance of this problem. This evening, we're fortunate enough to have a number of speakers that have a lot of experience on the subject matter. The format is going to essentially include myself calling the speakers up. They're going to give about a 10 or 15 minute presentation on their topic. And then once we've concluded with all of our presentations, we're going to have a question and answer period for all of you to ask any questions that might be on your mind, and we'll do the best we can to try and answer your question. So with that being said, we're going to get right on with the first speaker. Our first speaker is Mr. John Roberts. John Roberts is a co-founder of HERO, the Heroin Epidemic Relief Organization. John started this group along with Brian Kirk, another dad from Homer Glen, after they each lost a teenage son to a heroin overdose in 2009. Over the last 3 years, HERO has helped raise community awareness about the alarming increase in the use of heroin in our communities, especially by high school and college-age students. Through HERO, John Roberts is presently contributing to several initiatives designed to help families and communities impacted by the heroin epidemic, and working tirelessly to support drug education, prevention, and treatment programs. John?
Bob and I are actually colleagues. Something that he didn't mention is I'm a retired police captain from Chicago. I spent 33 years working in the city of Chicago, and I retired, finished my doctorate, and I took a job at Lewis University. I moved out to the west suburbs, residency requirement. I couldn't live outside of the city, but I couldn't wait to move out here. Teaching out here, I used to see these lovely communities. So I moved my wife and 4 kids right after I retired. And at the time, my oldest was just starting into college, and my youngest, Billy, was just finishing grade school. I was living the American dream, folks. I had finally made it out to the suburbs. But all of a sudden, things changed when my youngest son, Billy, started high school. And in our suburban community of Homer Glen, like a lot of high school kids, Billy was almost immediately introduced, challenged, tempted, whatever word you want to use, but he was introduced to drug use, like virtually all high school kids. Unfortunately, Billy made a poor decision, like a lot of kids, that he experimented with alcohol, tobacco, and some soft drugs, as they call them. We found evidence of him drinking. I had my neighbor say, "Can I show you something behind your shed?" I mean, as closely as I was watching Billy, I was shocked when I saw he had a fire pit with his friends, and they were smart enough to hide the beer cans, just not smart enough to move them far away from home. So, I mean, you know, I have a comment here that we are almost blissfully ignorant. I think like a lot of parents. You know, we are hoping that, okay, you know, he's a teenager, he's making some poor decisions, kids do, but we were hoping that he wouldn't become involved in hard drugs. Tragically, we were terribly wrong. And that's why I'm here tonight. You see, Billy was introduced to other drugs, hard drugs, and they're out here in your community. They're all over our lovely suburban communities. Seemingly safe and tranquil, beneath the surface, ladies and gentlemen, there are hard drugs being brought into your community as we speak. But the thing that I was really shocked by, I thought I had left behind something like heroin. I thought I had left that behind in the city when I retired. I'd seen it all my life. But I was shocked when I found out Billy had tried it. I was shocked that he could obtain heroin. I didn't want to believe it. With all my experience, I couldn't believe what he was telling me. How did you get heroin? I was shocked that he did not know how dangerous it was. And I was shocked so many other kids that his age range, he told me about it. So many other kids were using heroin. It was inconceivable. I mean, I know an awful lot about drugs and I know a lot about crime. That shocked me. So although my wife and I responded quickly to help Billy, before we knew it, he was gone. Just that quickly. That's how powerful and potent this drug is. Billy died of an overdose on September 20th, 2009, at the age of 19, a very short time after he experimented with this drug. Short time after losing Billy, I devoted myself to raising community awareness about the heroin epidemic. I was joined in this, as you heard, by another dad, Brian Kirk, who lost his son the same year in Homer Glen on April 3rd, 2009. Matthew was 18 and was just about done with high school. And he died of an overdose at his home. Brian and I and our family suffered, as many of you will agree, the worst tragedy a parent can suffer, or that anybody can suffer. You lost a child. I mean, we live with the pain and the loss every day. We we're coming to accept that fact. But early on, Brian and I decided we could not accept, while we could accept the pain, we could not sit idly by and see other families and other communities feel the sting of that tragic loss. So we decided to fight back, and we founded Hero. Our mission is to offer support, understanding, encouragement, and hope to families who have lost a loved one to an overdose. And we devote a great deal of our time to raising community awareness. We strongly support drug education in our schools, drug prevention, and we're involved in advocacy. We support the formulation and adoption of new laws and progressive new drug policies, because we need new ideas to finally win this war. And as our name implies, our primary target is and is going to remain heroin. There's other drugs out there harming our kids, but heroin is going to remain our focus, and for some time to come, I'm afraid. The reason this extremely dangerous drug is cutting a lethal swath through and across many of our communities in all of the collar counties. I still have a hard time believing it, but I've seen the evidence, and over the last 3 years, I've personally seen it, and I've talked to many of the families, and I work with them. I'm not sure if everyone here knows, but over the last 5 years, the overdose deaths in all the collar counties have doubled. In Will County, when I first looked, I had trouble finding the data, but now they count it as a separate category and they monitor it from day to day, week to week. At any given time, I can ask Pat O'Neill, the coroner, how many. At last count, there were 34 people who died of just heroin overdose in Will County. While this number may seem small, it's not small to the families whose loved ones are counted among that number. And it is truly a frightening number to the countless families who are currently struggling to save the life of a family member who's either addicted or in recovery. 34 sounds like such a small number. Ask any family who's hoping to not get the call I got. Okay, and there's thousands out there. So please allow me to speak on their behalf, and let me assure you how important it is that we bring this to the attention of this community and every community. Just about now, I suspect you're wondering if I'm an alarmist. I can answer that question. Yes, I am. I am an alarmist, but with good reason. It is because I see kids, families, and communities in peril. I am very alarmed by what I see each day. I work on this every day. I have become personally aware of the data from a few suburbs, which indicates that each month, paramedics on average are taking 4 or 5 of our kids to the hospital emergency rooms and saving their lives. I studied the data from one suburb, and over 3 years, they've been averaging 4 or 5 people being transported. I've seen the records, and in most cases, they're administering, the EMT is administering Narcan. It's also known as naloxone. If it wasn't for that drug, most of those people would never have made it to the emergency room. I've seen it work. It can bring you back from death's door. Without that drug, and without our public safety personnel carrying that drug on the paramedic rigs, the numbers would be staggering. Now, those are my personal observations, but my research, my personal research and observations are supported by a report that was released in 2010 by the Illinois Consortium on Drug Policy at Roosevelt University. This research revealed that more than 24,000 overdose transports are being taken to our hospitals on an annual basis here in the Chicago metro region, and it's worse in the suburbs than it is in the city. And ladies and gentlemen, this level of incidence resulted in Chicago climbing to the top of the list. Chicago is now ranked as the worst region in the nation for the heroin problem. So yes, I'm an alarmist, and I plan to continue going to every community, to every media outlet, and spread the word. I pledge to fight and to devote myself to this task, and I plan to do so in my son Billy's name until I join him. Ladies and gentlemen, I spent a great deal of my time studying this problem, and the evidence I'm finding is very disturbing. Too many of the numbers, or as I call them, the numbers that really matter, are climbing. These numbers are overdose deaths, emergency transports, and treatment admissions. Those are outcome measures. Those are the things we have to work on. When they go down, I'll say we're winning this war. Here in Downers Grove, as Chief Porter mentioned, you've lost 4 of your youngsters in this community so far this year. Even one's too many. Well, I've heard about the efforts that's being made here by the Downers Grove Police Department and DUMEG, who are both represented tonight. I think it's time we realize this problem is a particularly complex social problem that cannot be solved solely by law enforcement. Now, I've earned the right to say this after working all of my adult life in policing and law enforcement. So please do not misunderstand my comment. I strongly support law enforcement. I'm fiercely proud of the men and women I serve with. I often tell people that over my 40 years, I've seen officers on the front line in the trenches fighting the war on drugs, and largely by themselves. And that's something that we have to change. It's time that we realize this is more than a crime problem. This is also a health crisis. We have to start treating this problem in a much more serious nature than we ever have before. Like I say, I'm extremely proud of these men and women. I know both of these men. I've heard what they're doing. I know they're right on top of this. They're tracking it. They're doing what they can. You know what? I'm glad that we're here tonight in a high school, because one of their strongest allies is going to be this school system. And seeing this large crowd here tonight, I see a lot of other allies. And that's what we desperately need. In 2009, when I lost Billy, I began studying this, and I saw the true nature and scope of this problem. And at that time, Brian Kirk and I founded HERO. And at that time, and I'm very proud of this, I strongly recommended we include the word epidemic in our name. And tonight I will ask you, please do not leave here tonight without knowing that the problem we are facing is an epidemic. It is an epidemic because it is growing and spreading so quickly, and is infecting so many people with a disease called addiction. It can only be described as an epidemic in my mind. And I will ask everyone here tonight to help me change one thing about this epidemic. It is something that is within the power of every person here to change, and to change it right now, before it is too late. Please help me change the fact that this is the epidemic that no one is talking about. For the last 3 years, I've been amazed at how little attention has been drawn to this problem. I have often referred to this epidemic as the one that nobody talks about, and I usually make this particular point by asking everybody, do you remember H1N1, swine flu? Did you hear about that epidemic? Every night on the news for weeks and for months. We heard about that epidemic. That's the one they wanted to talk about. This is the one we'd better start talking about. With H1N1, we responded swiftly, mobilized a great deal of resources, launched many public and private programs to protect our community so that we would be able to deal with a possible outbreak. That epidemic, thankfully, did not claim many lives. I went and checked the CDC, Center for Disease Control. Every so often I go back and check. Let me show you the numbers, and please, I hope I can convince you to start talking about this epidemic. The Center for Disease Control recently issued revised estimates, and it seems that H1N1 flu epidemic may have claimed as many as 8,000 to 17,000 lives. That's a lot of people. That's a lot of families that were hurt. I only wish I could say the same was true for the heroin epidemic. I'm not a betting man, but I'd be willing to bet that actually the numbers they're putting out now are actually off by quite a margin. Right now they're saying we lost 36,000 people to drug overdose. The last year they have data for was 2008. Half of those were for opiate-based drugs. And like I say, I'm not a betting man, but I'd be willing to bet that we've already climbed over 40,000. Here's another one. Did you know that drug overdose deaths is now the leading cause of accidental death in our nation? It's exceeded traffic crash fatalities. Of course, I think we know the reason for that. Like H1N1, there's been a lot of attention devoted to that problem. And we've done something about it. As a police officer, I have seen many terrible traffic crash injuries and deaths, and so I'm grateful. And I'm sure everyone here is grateful that traffic crash deaths are in decline, and H1N1 didn't claim as many. I'm grateful that a comprehensive national strategy was launched to address these problems in such an affirmative manner. But as a grieving dad, and as someone who has devoted his entire adult life since I was 18, protecting my community, wherever I lived or worked, my community, I am now asking for a similar response to another very lethal threat in our community. I am asking others to help stand with me and help fight this epidemic. Ladies and gentlemen, we cannot allow the epidemic, the heroin epidemic, to be the one no one is talking about. We need to face this problem, and we need to find a solution. In closing, I would like to tell everyone, when I was invited by Chief Bob Porter and Deputy Chief Kurt Bluter, I jumped at the chance. Anytime Hero is asked to come to a community and talk to the community members or in a school, we always come. I know both these men, and we all worked at Lewis University together. We're all teachers. I know they're looking for solutions. I'm willing to help. I hope you are. I'm also personally acquainted with one of the finest officers in the Downers Grove PD, Officer Jim McGreal. I suspect many of you have heard about Jim. I hope you have. This young officer, a former Lewis student, is a real hard charger. He's received numerous awards for his drug enforcement work, and he's presently working on, I believe, the DEA task force and contributing to his community and fighting at a much higher level. I would also like to share with you that when the chief extended the invitation to speak tonight, I told him, I think it was Kurt, that the request was very timely because I had already been contacted by a concerned mother from the community, Miss Kathy Prohaska, whose son attends Downers Grove North. Kathy's here tonight. I gave her a wave when she came in. Kathy and I are friends, and she asked would I come and speak to the kids in the high school. And I said, anytime, just say when. I was also contacted by Miss Chris Tomek, who works here at Downers Grove. I mention these people by name to honor them and to credit them with recognizing the problem and being willing to not only talk about it, but more importantly, for finding a way to do something about it. They were stirred to action, and they are now helping to fight this terrible epidemic. And I got to tell you, I take heart every time I hear about a community taking steps to address the problem, or when I learn about a community launching a new drug prevention program. I hope the communities surrounding Downers Grove will soon follow your lead. Yes, your lead. You're one of the progressive communities that sees this problem and is doing something. You've joined the fight. I hope they will follow your lead. There's so much we have to do. With each new community, with each new initiative, I can clearly see a time when we will find ways to work jointly together to find solutions that are effective, new ideas. I've had the opportunity to work with many of the people that you're going to hear tonight, and I got to tell you, I'm honored. I'm honored to be counted among them. This is like the front line of the Bears, ladies and gentlemen. We're very good at what we do, and we're relentless. Until the game is over, we keep pushing, and we're pushing hard. And I'm sure that someday we will see that casualty count go down. We will see the deaths go down, the emergency room transports, and the treatment admissions go down. This is a disease, so when those numbers go down, we're winning the battle. I'm confident we can do this. If we can come together, we can make a difference. The reason I'm so confident that this is true, 3 years ago, when I was facing the darkest hours of my life, I found strength when just one man joined me and stood with me. He was another broken-hearted dad. But we two dads have come a long way. Just because we decided we had to do something about it, we had to stand together, and we had to fight. We had to fight to save kids, families, and communities. We turned and faced this problem. And now, a few years later, we are standing with so many more people who have joined the fight. And it's really heartwarming to me. It allows me to get through my day every day. So I will ask you, please have the courage to turn and fight this epidemic. Please be a hero. and save a life. Thank you.
Thank you, John. And I just want to add, John talks a lot about heroes here, and I just want to say, John, you're a hero. You're a hero for sharing your story with all of us, and I'm sure you saved many a life with your story. So thank you for being here tonight. Thank you for your remarks. Our next speaker this evening is Ms. Kathleen Burke. Ms. Burke is a Chief Executive Officer for the Robert Crown Center for Health Education. Kathleen Burke joined the Robert Crown Center for Health Education in July of 2005 and brought with her an extensive record of accomplishments. She has introduced an intensive collaborative effort to create a new model of health education that is relevant, sustainable, and effective for both children and for influencers. Thank you, Kathleen.
Thank you. First of all, thank you for having me here tonight. And thank you all for coming out. I'm so impressed with the number of people who have come out tonight because it's not very nice outside. And so there were a lot of reasons to stay home. And so I appreciate a community who starts to gather and starts to converse about an issue that John so nicely laid out is an epidemic. And it's a crisis in our communities. The Robert Crown Center for Health Education has been around for 50-some years. Many of you may have had children who've gone to our programming. I'm sure most of you think about us as a sex ed program, but we've also been doing drug education for the last 50-some years also. So we consider ourselves experts in helping kids make healthy choices and reduce the risks that they're going to take over their lifespan as they become young adults. This particular problem isn't a challenge. It's something that we're being faced with that came up suddenly and was not on anybody's radar. The police knew first, and when we started to get involved with them, they identified an issue that we recognized was only surmountable by reducing the demand. How do you reduce the demand for heroin? You educate. Prevention is through education. Because if we wait until a child is in a vulnerable position and happens to try the drug, that's a whole different story. And that story often does not have a happy ending. So the most important thing that we bring to you tonight is both sides of the story about what we can do from all different perspectives. 2 years ago, when we started working on how do we fight this new health problem, we looked around and we realized that the health education model that we were using, the way we were teaching drug education, obviously wasn't working. Because we had kids who were dying so young. And as a mother, that's just unacceptable to me. So we looked around at what things had been done in other places in the nation. We looked around at what the research was telling us about heroin addiction, and we realized that the research was old, that the face of heroin had changed. It was no longer adults, it was our young people. It was no longer an inner city urban problem, it was a suburban problem. And we recognized that the kids who were experimenting and using had no idea what they were working with, that we had not taught any of the children about heroin over the years. It wasn't on the agenda. We didn't see it. We didn't see it with the kids. So we knew we had to address this in a different way. We knew we had two things to do. We had to help the schools in the high schools deal with the current crisis and deal with something that was immediate. But we also knew that we had to lay the foundation for the children who were coming up in the school systems and who were middle school kids who were going to be in transition years, and we needed to prevent those kids from using. So what we've done is, through Roosevelt University, who John spoke about, we did some preliminary research that told us, well, so why are young adults using? Why are young kids using? What's making them turn to heroin? And the research shows us that there's a couple reasons. One, kids are fighting mental health issues. And when I say mental health, I don't want people to freak out and think that that this is something scary. What it is, it's emotional distress. It's emotional issues that we have the capacity to identify and support our kids. It's not a reason to hide behind the door of your home because you're embarrassed. It's a reason to seek out all the help you can in order to support your children when you realize that things aren't going so smoothly. We also know that there's an addiction to pain pills in this country. Not just kids, but adults. We're finding that kids are getting addicted to opiates through pain pills, and that at some point they transition to heroin for a couple of reasons. It's easier to get, it's cheaper, and it's a stronger high. The reason kids get addicted to pain pills is because of the manner in which we treat pain in this country, which is a positive thing. We do not want cancer patients being in pain. On the other hand, we've become a little loose with those medications, and people become addicted to it rather quickly and easily, and we need to address that. So we're working with physicians to talk to them about what we can do to improve the way we distribute pain medications, particularly when you're giving them to young kids because they've had dental issues or because they've had a broken bone or an injury on the playing field of a sport. We really need to be very cautious about how we're distributing that. The other thing that we learned was that the transition years are really important. That kids are most vulnerable when they're moving into different social situations. So when your children are going to middle school and they're all of a sudden around a whole different group of kids who come from different neighborhoods, and their social groups, the kids they went to their neighborhood school with, changes. Kids start to grow and develop and they have new interests. When that change occurs, the most important thing to a child, and actually to adults, is to fit in, to find their place in this new social structure. And sometimes when they're trying to find their place, they make bad decisions. Not because they're bad kids, but because they're feeling very vulnerable and trying to fit in. Just like when kids take heroin when they're feeling stressed and emotional, and disorders like depression, bipolar disease, social anxiety, they're self-medicating. They're doing something to make themselves feel normal, or what they think is normal. The transition to high school is even more traumatic because, again, especially in the suburban areas, you're going into very large schools with very large groups of folks that these kids don't know. And so it's a threatening time. And as parents, we need to keep the communication going and to keep monitoring them, because it's not so easy. It's not easy. It's not like it was when we were kids. It's not like it was when your older kids were going through. It's very different now. So given that we know that pain pills, mental health issues, and transitions are critical, how do we respond educationally? We took a look at the gaps in the content, the stuff that the teachers were not teaching in their health classes. Because I want to make it clear that the health education that goes on in the suburban area is pretty phenomenal. These are teachers that are dedicated to what they're doing. They do top-notch work, but this drug has not been on the horizon. And so what we did as a resource to the schools was develop the content, the lessons around what's an opiate and how does it affect your brain. We work with Rush University and their addiction researchers to develop and figure out what the most current science in your brain and how opiates act on your brain. We're trying to take what they know as soon as possible into the field so we can teach and we can help parents and kids understand that when that drug is ingested, it does some awful things to your brain. And we can show them exactly what that does and how that'll change behavior and how that changes their future. Because kids want things that are relevant and real. They don't want to be told, just say no, and they don't want to be told that drugs are bad for them because they don't agree that all drugs are bad for them. So we really need to distinguish that heroin and opiates will kill you, and you won't know when. And it's because of what happens in your body. And you can't change the way your body is made, so there's nothing that you can do to prevent that if it's going to happen. We also looked at addiction, and we're helping the schools and the health teachers understand what addiction means. You know, things move from use to abuse to addiction. And in this country, people deal with different kinds of addiction all over the place. We're talking gambling, we're talking alcohol, we're talking food. I mean, we're talking things that are used in a way that is out of control. When a child uses a drug that responds in their brain in a certain way, they lose the ability to control that. And so by the time that happens, we're down the road again into addiction. But kids want to know what addiction means, because what the research said to us, they don't know what that means. They really don't know what that means. They don't know that when they become sick, they're actually in withdrawal. They don't have the flu, and they're not responding to, you know, a tough night out, that they really are, their body is telling them they need that drug to survive. So given that we know that we need to teach different things, we need to teach it in a different way, our strategy has been to pilot it in different counties. We're working in Will County, we're working in DuPage County, we're working in Lake County, and we're working in suburban Cook. We're working with a cluster of schools, a high school and middle schools, to pilot the concepts and the materials that we've put together. At the end of this year, we'll know if what we think we did is helping, and whether we're going to offer it then to a broader audience. I know that doesn't help you folks who are looking at your kids are in trouble now, or you're really worried about them. But I encourage you to think about what it means to have a really good health education program in your school, and not to let the lack of interest or the lack of consideration that it's only a small group of kids we have to worry about. Heroin is in everybody's backyard. So as a community, I encourage you to come together and to work with your schools as partners, to think about how comprehensive is the drug education. Does it start at a young age? Does it go year to year to year to year? It can't just happen in one school year and in health class. It has to go year after year after year, because kids' social situations change, their experiences change, they have different questions. We have to talk to them about addiction, and we have to stop talking to them about drugs as a whole group, because they're different. And they don't believe us if we group marijuana with heroin. They stop listening, okay? And so it's not a matter of convincing them they should, it's a matter of allowing them to tell you that, and then teaching them where they're at. Not to try and fight the stubbornness or the assumption that they know everything, and that they are going to tell us what to do. But we want to help inform them, because they're smart kids. And when you give them the knowledge, they respond and they keep themselves safe. One of the most effective things that you as a parent can do is to get informed about heroin. Part of the pilot project includes just not the kids, but the whole community. The parents and the school staff. The whole community needs to be informed about heroin. You need to communicate with your children. And when they're in middle school and high school, that's not easy. They don't want to talk to you. They certainly aren't going to tell you anything. It doesn't matter. Try. Just keep finding out what's going on, and eventually they're going to be so tired of you asking, they'll start to tell you. Also, on the Robert Crown website, we have what we call pep talks. And it's just examples of parents trying to break the ice, or just trying to get going with the conversation. It's not about knowing all the facts, and it's not about knowing the statistics, and it's not about knowing the absolute details of what happens when a child is addicted on heroin. It's about listening to them about the challenges they're having fitting in. It's about listening to them about what's going on with their own group of friends. It's about listening when they lose a friend to heroin. That loss alone is traumatic. And I encourage you to spread the news, to talk about what you're learning here tonight with your neighbors, to create networks of friends, to create networks within your social groups, to create networks of parents, so that you can support one another. So that when you're having issues with your own family, you can talk to your neighbor about it. You can talk to your best friend about it. So that you're not hiding behind your door, stigmatized that I can't talk about this because this is heroin. People are going to think I'm a terrible parent. People are going to think there's something wrong with me. No such thing. We got to get rid of the stigma, because the stigma is what prevents us from moving forward and becoming an educated community. These aren't bad kids, and these aren't bad families. These are just kids who are having problems, who are developing issues developmentally that they're making choices that we would like them not to make. So let's help them do that. Let's not pretend that it's not going on, and let's not pretend that it makes them something weird, because the last thing in the world you want a kid to feel is, again, an outsider being ostracized and not being cared for by its community. So, in summary, the most important way to reduce demand for this is through prevention. Prevention through education is what's going to stop the epidemic. But we need all of you. There's not one magic bullet that the Robert Crown Center can come into your community and say, if we teach it this way and we teach this content, it's going to stop. We need every one of these folks at the table and in these stands to talk about this issue, to demand information about this issue, and to work as partners with the social service agencies and the schools to educate our kids before it becomes a problem. Thank you.
Thank you very much, Kathleen. Our next speaker is DuPage County State's Attorney Robert Berlin. Mr. Berlin was appointed DuPage County State's Attorney in 2010. At the time of his appointment, State's Attorney Berlin was serving as the Chief of the Criminal Bureau of the DuPage County State's Attorney's Office. In that capacity, he supervised all the Assistant State's Attorneys charges with the criminal prosecution function in DuPage County. On a personal note, I've had a lot of opportunity to work with State's Attorney Berlin, and I'm not a big political guy, but I could tell you that Mr. Berlin has done an outstanding job. He truly cares about the citizens of DuPage County, and he's a friend of law enforcement. So, Bob.
Thank you, Chief Porter, and thank you all for being here. One thing I'm going to ask all of you to do later tonight, tomorrow, in the next few days is please email, call, let your friends, let your neighbors know what you learned here tonight and get the word out. John Roberts talked about it. The media has not given this issue the attention that it so desperately needs. But it is an epidemic and it is a crisis. Just this year alone, since January 1st, we've had 30 overdose deaths due to heroin in DuPage County alone. Last year, in the entire year of 2011, there were 27. So we've already surpassed that total, which gives you some idea of what we're dealing with. Heroin, John mentioned this earlier, it's very addictive. Because what it does is it increases the firing of dopamine cells in your brain. And dopamine cells are what makes a person feel good. It gives you a feeling of euphoria, an elated feeling. And just for purposes of comparison, when you go out to dinner, you have a nice dinner, that gives you about 200 milligrams of dopium. Somebody who uses heroin gets about 1,000 milligrams of dopium. So it's 5 times the amount that you get if you go out for a good dinner. And what happens is they get that feeling and they want to get it again and again, and that's why it's so incredibly addictive. And it's very, very difficult to break someone of that addiction. We have seen in DuPage County a tremendous increase in the number of heroin possession cases over the past 2 years. Most of these defendants, they're not going to prison. We try and get them into treatment. We have a drug court in DuPage County. The numbers have increased in that court. But what we see time and time again, especially with heroin, is there's a tremendous increase, a tremendous amount of relapse. And they relapse over and over again. Sometimes they'll go 6 months or a year or 2 years without using, and the cycle starts all over again. We've had a lot of success with our drug court. Since 2002, we've had 592 people admitted into that court, and the graduation rate is almost 50%. Just some idea, to give you an idea of the difference between putting someone in a drug court or sending them to prison. It costs about $30,000 a year to incarcerate somebody in the Illinois Department of Corrections. We put them in a drug court and we get them treatment, it's about $3,000 to $4,000 a year. And obviously, the idea when we're dealing with addicts is to try and cure them of the habit and make them productive citizens of society. And that's what we're trying to do in the State's Attorney's Office. Now, we've had a number of legislative efforts which have helped us and given us some tools to tackle the heroin issue. And I want to say that tonight, State Representative Patty Bellock is here. State Senator Ron Sandak, former mayor of Downers Grove, is here as well. And they're both tremendous partners in this war on heroin. Just this past summer, on August 9th, the State General Assembly passed a law that now makes possession with intent of 3 grams of heroin or more non-probationable. It used to be 5. So that has given us a good tool to go after the heroin dealers, which is great. And we've arrested and prosecuted a number of those. But the reality is most of the heroin that our kids are using in this county comes from Chicago. And they drive the heroin highway, they go to the west side, and that's where they're buying their heroin. And there's tons of it out there. There's tons of drug dealers out there. Now, we have partnered. You're going to hear more about this, I'm sure, from Matt Gaynor. We've partnered with Cook County. We've partnered with the collar counties. There are efforts underway to try and address that issue, but it's an enormous problem. And the reality is the criminal justice system alone cannot deal with this problem, which is why it's so important to educate everyone and to keep our kids from using it in the first place. The Illinois State Crime Commission has offered $1,000 rewards to anyone arrested, anyone giving information leading to the arrest and conviction of someone selling heroin to a juvenile. And there's money out there, and it's available, and it's obviously for a good reason. There's also recently the legislature passed the overdose limited immunity law, which basically says that if you, in good faith, call emergency paramedics or the police or an ambulance because someone is having an overdose, that anything under 3 grams that the police may find as a result of the response, you cannot be prosecuted for. And the idea behind that law was to encourage people who are with someone who's overdosing to call for help. Because there were situations where someone was afraid to call, they're afraid to call an ambulance, they're afraid to call 911 for fear that the police are going to find heroin or some other drug and they're going to get arrested and prosecuted. So that law was passed recently to address that issue. I just want to talk to the parents a little bit about what you can do and things to look out for if you think that your child is using drugs or heroin. Things to look out for: personality changes, withdrawal, your child spending more time in their room, change in appetite, lying or deception, or their sleep habits change. Obviously, a notice that they're not performing as well in school. If you notice something like that, frequent headaches, anxiety, depression, these are all signs that your child may have a drug problem. What can you do as a parent to look out and keep a better eye on what your children are doing? You know, before I became state's attorney, I spent about 3 years as the supervisor in juvenile court here in DuPage County. And I've done a lot of research on this issue. I've done a lot of research on what parents can do to keep their children out of harm's way. And the easiest thing is get your child involved in after-school extracurricular activities. There's no question, the research has shown, the busier your children are, the less trouble they're going to get into. But you've got to know who your kids' friends are. I mean, it's very simple, but you've got to keep an eye on who they're hanging out with. As we all know, our children don't communicate the way we used to when we were kids. No one calls the house phone anymore, except maybe your parents or people our age. Kids text each other. They Instagram each other. They email each other. That's how they communicate. And you've got to have an idea of what's going on with their cell phone and monitor that cell phone use. There's software and there's programs out there that allow parents to monitor their kids' cell phone use. And you may think that, geez, that's really Big Brother. Do I really want to do that? Well, if you know what, if you suspect something's going on, I would say yes, you do. You have to remember that, as parents, we love our children. We're there to help them, to nurture them, to guide them, but we're not their best friend. And you have to remember that, some decisions we make as parents, and I'm speaking to you as a parent now, not as a state's attorney, because I have 2 children of my own, and I have the same issues that many of you have. You got to use your best judgment and do what you think is right for your kids, and sometimes it's not easy. Pay attention to your kids when you talk to them. Don't be sitting there talking to them and checking your email on your cell phone at the same time, or texting somebody. Really, when you talk to your children, pay attention and listen to them and engage them in conversation. Be interested in what they're doing at school and what they're doing with their friends. Support their activities by attending all their events. If they're using your car and you suspect they may be using drugs, check your iPass account. Very easy to do. And if you see activity on 290 going into the city, something's going on. Be a good example to your children. Don't do things in front of them that you wouldn't want them to do. Children do imitate their parents. They pick up the same habits. When you have your friends over, be careful about drinking in front of them, because your children will see that it's not a big deal and they'll feel the same way that it's okay for them to do. If you think there's a problem, don't be afraid to search their bedroom. Okay? It's your house. Don't tell your kids stories about your own drug use or things that you did in college or your own alcohol use. Everyone has college stories, but don't share them with your kids. Explain to the consequences of drug and alcohol use to your children. Their driver's license could be suspended. Kids under 21 driving with any amount of alcohol, whether they're DUI or not, it's a zero tolerance suspension. They're going to get their license suspended. DUIs, when you're convicted of a DUI, it cannot be expunged ever. That stays on your record permanently. And remember that, when we're talking about heroin, possession of any amount is a felony. And when we talk about aggravated DUI, you don't need impairment. So the fact you may be DUI based on drugs because it's in your system, and it may be that you used it 3 or 4 days ago. You may not be impaired 3 or 4 days later, but if you get into an accident and cause an injury, and a blood test shows that there is heroin or cocaine or any other drug that's in your system, that makes it a felony and there are serious consequences. The average cost of a DUI, whether it's DUI alcohol or DUI drugs, by the time all is said and done, with the cost of the fines, the fees, an attorney, going through all the counseling, is about $16,000. As I said earlier, you know, we do a great job of prosecuting drug cases in DuPage County. The head of our drug prosecution unit, Audrey Anderson, is here tonight. She runs a phenomenal unit, and we're very active. We do go aggressively after drug dealers in our county, but as I said earlier, the heroin that's coming into the county is coming from Chicago. It's really law enforcement. There's only so much that we can do, and it's really a health epidemic, and it's an education issue. And that's why it's so important that all of you are here. Please spread the word. This is an epidemic. It is the most addictive drug, and you know, if it gets to us, by the time we get to that point, so many times it's too late. You know, we try and we do whatever we can in the criminal justice system to deal with these kinds of cases, but it's extremely difficult. It really is. So, you know, I applaud all of you for being here. If anyone has questions about any of this, please call me, call Audrey, call anybody in our office. You know, we are doing whatever we can, but this is a community problem, and it's going to take a community effort to break this cycle of addiction. Thank you all.
Thank you, Bob, and thank you for all you do as our state's attorney. Our next speaker is DuPage County Metropolitan Enforcement Group Director Matt Gaynor. Matt is currently a Master Sergeant with the Illinois State Police. Master Sergeant Gaynor has been a member of the Illinois State Police since 1995 and has held assignments with the Division of Forensic Sciences, District Chicago Patrol, and Zone 1 Investigations Unit. While serving in the Investigations Unit, Master Sergeant Gaynor investigated narcotics trafficking, firearms trafficking, homicides, and police officer-involved shootings. In September 2011, Master Sergeant Gaynor was appointed the Director of the DuPage County Metropolitan Enforcement Group. Matt?
Well, as that was being read, I thought two things. One, I shouldn't have made it so long, and two, I feel a little old since the gentleman to my right reminded me that he was in high school when I started as a policeman. And I would like to echo State's Attorney Berlin's comments. I am one of those parents. I have two teenagers at home. I have GPS trackers on both their phones. I know where they're at all the time. I search the cars. I search their rooms. They don't know it, but they will when I find something, if I find something, and hopefully I never will. So you won't be alone, those parents that want to start searching. You know, ask the questions, the probing questions, the annoying questions, the ones that the kids hate talking about. And I find personally the best time to talk to your kid is when you're driving in the car, because they got nothing else to do but listen. They can't walk away, they can't play Xbox, and if you take the phone away, they can't text anybody. So with that, like Chief Porter said, my name is Matt Gaynor, and I'm a Master Sergeant with the State Police and assigned as the DUMEG Director. Established in 1985, DUMEG was originally a street-level narcotics unit created to combat the sale of narcotics in DuPage County. However, due to the evolution of policing, DUMEG is now equipped to handle a wide variety of investigations, including but not limited to undercover drug purchases, search warrants, controlled deliveries, and wiretaps. DUMEG represents 23 DuPage County communities, including the Illinois State Police and the DuPage County State's Attorney's Office. Of the 23 member agencies, 12 have dedicated police officers assigned to DUMEG on a full-time basis. Downers Grove is one of those 12 communities. DUMEG is supervised by 2 Illinois State Police Master Sergeants who act as the Deputy Director and Director. DUMEG investigators work in an undercover capacity. Simply put, Investigators spend a majority of their time each day interacting with the criminals in our society, establishing trust, purchasing illegal narcotics, and ultimately arresting those same people. The primary focus of DUMEG is to purchase narcotics from drug dealers in DuPage County. DUMEG agents purchase all types of illicit narcotics, including cocaine, cannabis, heroin, prescription medication, and ecstasy. Officers assigned to DUMEG are indemnified by the Illinois State Police. This indemnification allows DUMEG agents to work outside DuPage County should that become necessary. DUMEG also has relationships with many federal agencies and works with the Immigration and Customs Enforcement, the Bureau of Alcohol, Tobacco, Firearms, and Explosives, the Drug Enforcement Administration, and the Federal Bureau of Investigations. Today, we are here to focus on heroin and its effects on our community. I was asked to speak specifically about what DUMEG is doing about it. The plague that is heroin is not something that is being taken lightly by law enforcement. I recently attended a summit of over 200 law enforcement agencies from across Illinois to discuss the heroin epidemic. What was abundantly clear at the meeting is heroin does not care where you live, how much money you make, what you do for a living, or what your level of education is. Heroin is a problem that transcends all boundaries. Heroin is a highly addictive drug that has become more pure and more available in recent years. Chicago has been given several nicknames over the years, one of which among law enforcement is the heroin capital of the United States. Within the city limits, Chicago's west side has become the focal point of heroin's availability. The proximity of DuPage County to the west side of Chicago is no doubt a contributing factor as to why DUMEG heroin seizures and purchases have increased in the past several years. In 2010, for example, DUMEG seized approximately 300 grams of heroin, a 650% increase from 2009. In 2011, the increase of heroin seizures continued. In 2011, DUMEG seized over 650 grams of heroin, an increase of 218% compared to 2010. In total, DUMEG has had over an 800% increase in heroin purchases and seizures in the past 2 years. These seizure amounts may not seem large, but I ask you to keep in mind that a typical DUMEG heroin investigation results in the undercover purchase of approximately 15 grams of heroin, qualifying that dealer for a Class X felony, which is punishable up to 30 years in the Illinois Department of Corrections. DUMEG does not often purchase large quantities of heroin. Heroin arrests account for approximately 20% of DUMEG's enforcement activity. That being said, with the cooperation of the DuPage County State's Attorney's Office, DUMEG enjoys a conviction rate of approximately 99%. So if DUMEG agents are investigating the sale of heroin in your community, you can rest assured that those responsible for bringing heroin into the community are being held accountable. DUMEG is also part of a DuPage County Heroin Task Force, which is a cooperative effort among all DuPage County law enforcement agencies to work with the Chicago Police Department and the Cook County State's Attorney's Office to follow the sale of heroin into Chicago and suburban Cook County, attempting to slow heroin's availability to DuPage County residents. Now, I'm sure many of you are asking why heroin is so readily available and why aren't the police doing something about it? Again, at this heroin summit I attended, I learned in the Chicago Police Department districts that make up the west side of Chicago, which is 2 districts, the 11th and 15th, there are approximately 175 open-air drug markets. Of those open-air drug markets, approximately 70% of them sell or have readily available to sell heroin. Those open-air drug markets operate similar to businesses here in Downers Grove. For example, dealers are organized, they work shifts, there is a clear chain of command, and there are consequences for those employees that do not follow the rules. On average, these open-air drug markets, when organized, profit approximately $3,000 to $6,000 per day. Our partners in the Chicago Police Department are doing their part. In 2011, the Chicago Police Department arrested approximately 9,000 offenders for drug-related crimes. Of those 9,000 offenders, 4,000 were for drug crimes related to heroin. Unfortunately, it's clear to law enforcement and street gangs have demonstrated repeatedly that once an open-air drug market is dismantled, a replacement is up and running in a very short period of time, often within hours, if not hours within a day. The financial benefit to street gangs far outweigh the risk of going to prison. I've provided these examples not to overwhelm anyone and certainly not to blame anyone, but merely to explain that law enforcement alone can't solve the heroin epidemic in our communities. I have to go off script here, so if you could bear with me 1 second. As I was walking out of my office today, I got an email with some updated statistics for 2012 to demonstrate that this is not a problem specific to DuPage County. McHenry County heroin deaths are up 150%. Lake County has experienced a 130% increase, and Will County heroin-related deaths are up to 93%. This trend continues in southern Illinois. St. Clair County has had their heroin deaths increased from 27% to 39%. Madison County, 52% of their drug-related deaths are due to heroin. We talk about the purity of the heroin, which is oftentimes leading to the heroin overdoses. According to the DEA, the average purity of heroin in the Midwest during a 2011 monitoring period was found to be approximately 31%. Several samples were well over 50%, and the highest sample being 89.7% pure. So, as an example, if an addict is used to ingesting a 13% purity heroin, and they buy a sample of heroin that's 89% pure, the odds of them having an overdose go through the roof. Information from our first responders have indicated that Narcan, which is used to reverse the effects of heroin, for years 2 milligrams was enough to reverse the potency of the heroin. But because the purity is on the rise, the amount of Narcan has doubled. It now takes 4 milligrams to reverse the effects of heroin. Again, I'm not trying to alarm anyone, but as it's been said repeatedly, this is something that everybody has taken a stake in. And it's, in order to combat the effects heroin has on our families and on our communities, it will take a multifaceted approach involving the combined efforts of law enforcement, non-for-profit organizations like HERO and the Robert Crown Center, educators, and obviously you, the public. Thank you.
Thanks, Matt. Our final speakers this evening going to be two of our tactical officers, Officer Scott Bezecki and Officer Mike Eddy. These two gentlemen serve in our department's TAC unit. They're pretty much at the front lines of what we're dealing with in the area of drug trafficking and drug usage. So without further ado, I'd like to introduce to you Officer Mike Eddy and Officer Scott Bezecki to talk to you very frankly about what we're seeing specifically in Downers Grove. Scott.
Thank you, Chief. My partner and I would first off like to thank everybody for being here tonight, informing themselves on the heroin use in Downers Grove. As Chief Porter shared, we're here to speak about what we're seeing on the street on a daily basis. We're the ones, myself and Mike, working every day with what we're seeing here. If there's one thing we want you to leave with tonight, is that from what we're seeing in Downers Grove, the use of heroin is spread throughout the entire town. It's not the north side or just the south side or not one just particular area of town. Seeing that this issue is impacting our community, we need everybody's help in looking out for the well-being of our children and our families of this community. Tonight, what Mike and I are going to focus on are statistics of heroin use at Downers Grove, street knowledge of heroin from what we've learned from interviews, investigations, and medical calls, warning signs of heroin use, and finally, what our unit is doing about the heroin in our community. Starting with the statistics. In the last 2 years, we've reviewed our incidents for heroin. We found that in 2011, we've had 17 arrests for possession of heroin. We've had 4 medical cases that involved heroin, and we've also had 3 overdose deaths as a result in heroin in last year. Year to date, we've had 13 arrests for possession of heroin, 5 medical cases that involved heroin, and also 4 overdose deaths, which has been spoken about previously. If those statistics are not alarming enough, they do not also include Downers Grove residents who have contacts with heroin, whether it's an overdose death or possession or a medical call when outside of our village limits. We simply don't have the statistics on all those numbers, which would obviously increase the amount of households that are affected in our community. This has impacted me as a police officer because, like Chief Porter has explained, we were all at the police department when we heard that mother cry over the news of what happened to her son. I've been in houses and I've had to deliver news that your son or daughter is in Chicago and deceased as a possible heroin overdose. Not an easy thing to do, and I hope that I never have to say those words to a mother or father again. What the past 2 years have shown us is that we're arresting around the same amount of people for heroin possession in town, but that the medical calls and the heroin overdose deaths are increasing. Myself and Officer Eddie, along with help from the village, have put together a map to my right here. What we've done is plotted out 2 years of possession arrests, overdose deaths, and also medical calls involving heroin. We encourage everybody after the question and answer portion of tonight's presentation to come up and take a look at the map, and it reinforces what we're trying to get across here is that it's spread throughout the entire town. It's not just one area of town. Myself and Mike will be available for further questions if anybody doesn't want to discuss anything in an open forum. Moving on to street knowledge. Street knowledge is something we termed as what we've learned through the past few years based on our investigations, interviews, and medical cases. The common age range that we're seeing in Downers Grove is 18 to 25 years of age, which is pretty common for what we're seeing nationally. Users are not following any type of stereotype. We're seeing users that come from every gender, race, educational background, and income level. It doesn't really matter who you are with this drug. The street value of a single bag, foil, or capsule of heroin is normally $10. This seems that the drug will be affordable for a first-time user or a curious drug user or somebody that's pressured by peers to use it. It's not until somebody starts using multiple bags, 5, 10, 15 bags a day, to where it gets out of control and they're not able to afford their habit. It's at that time where we usually see a lot of users where they're living a life of crime to get money to try to apply their habit. Larger quantities are commonly referred to as jabs. A jab is 12 to 13 bags of heroin, which is commonly sold for $100. What we see with people buying jabs is either more progressive heroin users that have used it for a while, or we'll get groups of friends that will get together and they'll drive down to Chicago or wherever they can get the heroin, and they'll pool their money together, because when you buy more heroin, you get a reduced rate. You're buying in bulk. Our units had contacts with all types of heroin users. There are functioning heroin users that hold down jobs. They might use 2 or 3 bags a week. Unfortunately, we see the more serious addicts who are using multiple bags a day, and the reason why they're popping up is because we're seeing them in crime-related behavior throughout town. Most heroin users that we come across start by snorting the drug. It's not commonly, nobody likes needles. It's not common for somebody just to start with needles from there on. We see people snorting the drug first, and then they move on to injecting it to try to achieve that same high that they once knew when they first started it. Like I said before, we're also seeing commonly for groups to get together to divide up their money. These are usually groups of friends, and the heroin is usually separated based on how much people are paying for the heroin, and then what the dependency of is each user. What we're seeing is heroin is commonly purchased near numerous exits in Chicago off I-290, which has been talked about before here, about it's commonly referred to as Heroin Highway. We also see it being purchased in areas of Cicero, Maywood, and Bellwood. Throughout our investigations, as spoken before, you, the parents, can take proactive steps to take a look into your kids' bedrooms, the cars, check the iPasses, check the miles on the car. If you see paraphernalia in the bedrooms, take those next steps to see what you can do to help prevent this. As I explained before, quick unexplained repeated trips back and forth to the city is a pretty good indication. If you're not staying down there for any other reason, you're going to see that 30 or 40-minute lapse on the iPass. We have seen a growing trend of dealers from Cook County willing to come out to DuPage. Everybody needs the money in these times, and it's not any different for drug dealers. They're willing to come out to Downers Grove and deal to everybody that's living here. We can even see dealers that are popping up in our community. I mean, this happens everywhere. And that's what Mike and I are working to combat right now on that. In Downers Grove, we're normally seeing the off-white powder version of heroin. There are the 3 types, which is the white, brown, and the black tar. We're not really seeing black tar, and we're not really seeing brown. It's off-white, and that's what we've always seen in the last 3 years that Mike and I have been in the unit. Heroin dealers that are selling the heroin are cutting it with whatever they want. It's commonly cut with sleep powder. There is an uncut raw version, they say, which we know is not 100% pure, but it's a lot more pure, and some of these users are coming back and actually cutting it up themselves. They might be selling half to supply their addiction, or they might just be using all of it and they just want to cut it themselves so that they know what's inside of it. Another misconception is heroin's only shot up in the middle of your arm after you're done snorting it. We've come across a lot of different people too that they might inject it anywhere in their body just to hide it from the public, hide it from teachers, hide it from police, hide it from their boss. So that does happen. That's a summary of some of the street information that we found important to share with everybody, with our audience. I'm now going to turn over to my partner, Officer Eddie, who's going to speak about warning signs and also what we're doing as a unit to combat the heroin problem in Downers Grove.
Thanks a lot, Scott. And the big guy in the suit looking uncomfortable, he's my partner. We're your two plainclothes officers in Downers Grove. We primarily handle narcotics investigations, but we work with other agencies. I'm going to talk a little bit of this was covered already, but it's real important to me for parents and family to know what the common signs associated with heroin use are. It can't be stated enough. This is going to be our experience and what we see on it. Certainly any kind of sudden behavior change is one sign. People usually are cheerful and full of life. They suddenly become sullen and angry and detached when they're influenced and addicted. Many times there's a failure for the addicts to take interest in simple things like hygiene and grooming or dress and appearance. They just don't care. Changes in peer groups is always common with what we see, that they start hanging around with other people they use. The drug becomes more of an important part of their life, and they're going to hang out with the other people that use that and kind of go along with that. Even the oldest and most trusted friendships for an addict, they get left in the dirt. They just don't care. On the flip side of this, the long-term addict, sometimes we see them kind of go into isolation with the purchase and the use of the heroin. They'll tribble off somewhere, keep their phone, go and buy it and use it and come back home, and nobody's the wiser. They take great pains to kind of keep away from others what's going on. Drug paraphernalia is always going to be present. It's too many to list. Every time I think I got them all down, there's always something new that they're using to try to cook up their heroin or use it. Some of the major ones, I guess, would be needles and syringes, scales, grinders, small bags, the empty packaging material, empty capsules. They're cooking it in spoons, so you're going to find spoons with burn marks on it. They like to take sections of aluminum cans from a soda can, take the bottom end of it and cook it in there. So if you see a burnt section of a cut can, these are pretty good indications. User will try to hide the true purpose of these things, but you just can't, there's no question about it when you put all that together, what it's used for. Inevitably, an addiction to heroin is going to cause money problems. The habits cost money. Those who become addicted will ask friends and family for money. When that fails, they'll start committing crimes to get their money, to get their product. It's a wide range of theft-related crimes that we end up seeing. Mainly, it'd be like theft from motor vehicles, retail thefts. Some addicts have even resorted to residential burglaries, and then, of course, they're stealing from their family and friends. There's usually some missing possession items associated with heroin use. You're going to go to a house or somebody's room, and items you would normally see in there, they're not going to be there, like TVs and computers and video game systems, appliances. They're going to sell those things. They're going to turn around and take them and sell them to a pawn shop, take the jewelry, sell it to a cash for gold, take that money and go out and buy the product that they need. There's obviously going to be some kind of marked drop in work or school performance. People end up missing meetings. They start becoming absent, calling in sick a lot. Students, their grades fall. They fall usually to failing levels pretty quick. A perfect attendance student becomes truant. And the same child that wanted to go to college just doesn't care about that anymore, and it takes a back seat. Physiological signs are pretty obvious to me. Those who shoot up heroin, obviously they're going to have those track marks. They're not giving the body the time to heal, and it's going to be evident. They try to hide it at first, and then the body just responds. It's not able to heal in time. Subjects who snort heroin, usually have bad breath, and their teeth start rotting out and changing color pretty quick. There's rapid weight loss associated with this, decreased appetite, paling of the skin. When you're actually on the influence of heroin, you're under the influence, you're using it, the pupils will pinpoint out pretty definitively. They start nodding off, they can't stay awake. Normal daily activities, they're not taking any interest, they're falling asleep a lot. It has to do with the heart rate and the respiration being depressed with the use of the drug. We put together a little 5th grade science project out there with some pictures out in the lobby. You're welcome to go ahead and take a look at it. Some of the common packaging that you'd see associated with heroin and some of the paraphernalia as well. I'm going to transition to what we're doing in Downers Grove right now to help out with this. One of it's what we're doing right now. We're talking to you about it. We're making ourselves available to you. We want to educate you. We want you to know about this. We want you to know about us. Specifically, Scott and I function together. We gather intelligence based on our own arrests or other arrests that the street would make, the patrol officers would make, or other agencies that would make that would impact Downers Grove. We find out who they are, where they're getting their heroin from, and all that. Each case is screened and examined and discussed, usually with one or more bosses and state's attorney's office to determine what the full potential of the case is. We don't want to jump on it real quick if we can get further up the food chain and figure out who's bringing it out or how it's being distributed or who else is in their little circle of use if it's a user. And then each case is prosecuted by DuPage, obviously. Our unit is committed to following up with every heroin case in Downers Grove. We're doing our best to determine the information on the sources of the heroin. We use informants, so we have people working for us that are either working a charge off or a crime off or for money. We get anonymous tips from the community. We go on Facebook and we look around a bit and see what's going on. There's a lot of weird stuff going on Facebook, and I'm not afraid to go on there. I'll start poking around. Usually it's under some other pretense, but I'm going to figure out what's happening, who these people are, what they're doing, who their friends are, who their friends' friends are. I can't believe the stuff that gets posted on that forum. We take this intelligence that we gather and we work with the other agencies. We work with DUMAG. We work with the DEA. Obviously, we have officers in Downers Grove that are tasked to both of them. It makes it really easy for us to work with them. And then we work with other larger organizations. They give us some manpower that we need to do our investigative cases so that we can have a successful result in it. We assist our local investigation units, our Downers Grove detectives. There's some of them sitting out here right now. We help them with the overdose cases. Help them identify who the sources of the heroin are, who gave the heroin to the victim, how it was administered, who the subject that overdosed was talking to on the phone or texting to before he became a victim. We work with the local surrounding departments too, Woodridge, Lisle, Lombard, Villa Park, Darien. We help them conduct their investigations. We're all in this together. It's a phone call away. We're always emailing and texting each other, even in other departments, to try to figure out what we can do to help each other. We get a pretty good notification from the Cook County State's Attorney's Office whenever we have a local resident that gets charged with a possession-related offense, and we use that information as intelligence too. And then the last and the most important thing that I can ever think of that we do and the help that we get is from the community at large. Nosy neighbors. I want them. I want you calling. The worst that it's going to come out of it, I get to know who you are and you get to know who I am. I don't mind. I want you to be nosy. It's the single greatest supply of information from us. I can't be in every neighborhood every day. There's 2 of us. We can't do it. So we're relying on you to either phone it in or phone and talk to me. I want to know. We're willing to do the work. We'll follow these subjects. We'll watch them commit the wide variety of crimes that they commit to support their habit, all the thefts and all that stuff. We'll gather all that evidence. We'll take the pictures. We'll figure out what they're doing, and then we're going to charge them, and then DuPage will prosecute them. And we're going to give them the help that they need. There's nobody waiting to high-five me every time somebody gets incarcerated. We want to help them out. They get that court-mandated program for the drug courts. That's what we want. We want them to get the help. We rely on you observant residents to communicate to us on what's going on in your neighborhoods. We need your help. Don't be afraid or apprehensive to contact us. Some people are really afraid that I'm going to write their name down in a report and it's going to go in the paper. You can remain anonymous. I don't care. It's usually going on the back of a dinner napkin anyway. So let's work together on this. You could be anonymous and we can get that information. We'll roll with it. Our numbers are going to be provided in some of the handouts in the front there. My partner and I, call us, email us. You can do it however you want to do it. I'm not here to embarrass anybody. I'm here to help, and I want to be there to help. We're proud to do this job. It's not easy. It seems like some days I never get home, but I want to do it. I want to be a part of this, and I want your help to do it. Thank you.
Thanks, Mike. Thanks, Scott. Both of these officers do a very good job on drug investigations, and one thing that they also do a really good job on is meeting with parents. I know we get a lot of phone calls that may come into my office or their office, and they go out and they meet with parents to suspect that maybe their child is using, and they do a really good job in that regards as well. That concludes the formal presentation process. So at this point, we would like to open it up for questions and answers. If there's a question that comes from the audience regarding a pending investigation, obviously that's not something that we can necessarily comment on at this time. If you're not comfortable in asking a question, you can always call me. You can call one of our TAC officers or any of the people represented here today with your questions after the fact. I also wanted to mention that we also have representatives here from both North and South High School. We have Kristen Borman from Downers Grove South. Raise your hand, Kristen. And we also have Keith Bullock from Downers Grove North, the Students Assistant Coordinator from there as well. So we work very closely with the high schools. We have officers assigned to both North and South High School, and we work very much hand in hand with their administration there. So at this point, I know I have somebody going to be walking around with a microphone from my staff. Deputy Chief Luter has graciously volunteered to be the microphone coordinator, so if anyone has any specific questions for us.
Hi, I was just wondering if, since heroin use is on the rise, are other drugs going down? Is this like replacing other drugs?
Actually, and unfortunately, heroin's becoming the drug of choice. Matt mentioned that we were at Moraine Valley Community College the other day. We had some great presentations. I was really proud. There was 86 police agencies, over 200 officers there. I've heard this data before from DEA, but you might be surprised to know that a lot of cocaine is now going to Europe, because it's fetching 3 times what they get, the Mexican drug cartels are getting for it here in the U.S. So the amount of cocaine coming in, a hard drug that ravaged our communities in the 90s, is starting to go down because the supply isn't as plentiful, it's less pure and more expensive. So we're starting to see that drop off. Unfortunately, in its wake, or replacing it, is heroin. Heroin is coming in by the tons across our borders, all along our interstate expressways. It's coming in across, by and large, our Mexican borders. The Mexican drug cartels are making billions of dollars. So there's other drugs out there, and I'm delighted to see that right now, at least, crystal meth is in decline, but they are trying very, very hard. The Mexican cartels are now producing it south of our border. We pretty much, law enforcement did a great job crushing some of the markets. It never really hit our area, but now they're sending it up with shipments of marijuana, just trying to get our kids hooked. If that one takes a hold in our communities, we're really in trouble. The 2 worst drugs out there are meth and heroin.
Questions?
Talked about the what's defined as the problem of drugs, and I'd like you to speak to the issue of that the drugs are not a problem, that they're a symptom of a problem. And if you spend a lot of time, or almost all of your time, dealing with a symptom of something, you will never change the character of the problem. And I think all of us realize that the long-term consequences of drug use is destructive to the person, to the loved ones, to the community. But one thing that we have to admit is that the drugs deliver what they're designed to do. They provide a way to escape. And I think we may want to spend some time looking at what our young people are trying to escape from in this society. And I don't think you can explain it just by saying there are individual inadequacies or transitions. I think it speaks to society, and I'm wondering whether we're asking that question.
I'm very cautious of using that word escape, because escaping from what? The research shows that kids are suffering from mental health issues and they're self-treating, okay? So if you want to go back to what's causing that, I'm not a psychiatrist, so I can't address that. But there's treating symptoms that are making them uncomfortable because they're trying to be normal. You can blame it on society in general, but we can't act on society in general. We can only act at a grassroots community base to help the kids that need help now. And escape is, these kids aren't trying to escape, they're trying to live in a world where it's difficult for them. And that's what we need to help them do.
Thanks, Keith.
First of all, you've been talking about Downers Grove all night. I'm from Lombard, just thought it. And we still would like to know, I think we have a problem there too, because it does create an interest just to come here and listen. What my main point is to ask you is we have clinics, methadone clinics, yet the methadone is addictive in itself. And it seems like you're killing an elephant with a whale. It's no different. So that's a question I have.
I think you heard tonight that this is a medical issue, okay? This is a health issue. The doctors are coming up with treatments to impact what that drug has done to the brain. Methadone is one older drug that was to help the cravings that occur because of the addiction to the drug itself, which, and you heard Bob talk about the dopamine. All right, these are real chemical reactions that are happening in your brain. So there are other drugs that are coming out now to assist people. But I liken it to people who have diabetes. Would you tell them they can't have their insulin because they need it in order to survive? It's no different than that. Folks who have a change in their brain chemistry need to have medical assistance in dealing with that.
Can I add to that too, that this is a medical problem? I referred to it in my comments. You heard me praise our law enforcement community. They've been fighting this, like I said, almost without help in many regards. Well, I now support, as ardently as I can, prevention, treatment, and research. We need all three. The police need, that's like the military going into war, going into battle without the artillery or air support. The police need the other three. We need prevention, treatment, and research. There's other drugs out there. Methadone's been around a long time. It is addictive. There's also Suboxone, and now there's a new drug called Vivitrol. And then there's a study I read from Australia, and it's the silver bullet, I hope, a derivative of naloxone that once administered would stop heroin from being effective. I pray every night that they find that drug that will prevent heroin from ever affecting another human being. And then we can tell Afghanis to take their heroin. Well, never mind.
Next question.
Hi, my question is, why would the drug dealers on the west side of Chicago increase the purity level if it's ultimately going to kill the consumers that they're trying to sell to? And when they market it, do they market it telling their customers that it has an increased purity level because those particular drug addicts need a bigger high? I guess. Do you understand my question? So why would they keep jacking up the purity level if it's going to kill off ultimately the people they're trying to sell to?
What we have found and what our partners in the DEA have told us is the drug dealers on the west side, believe it or not, are not chemists. Oftentimes, they don't know what they're doing, and it's by trial and error. What they do a very good job of is marketing their product. When a new open-air drug market starts on the west side or in the collar counties, what they do is they have what they call a giveaway, which is they advertise among the hypes, the users, the addicts, and they give them a time and a place to be somewhere. It's in an alley, it's on a corner, it's at an abandoned storefront. And what the users do is they line up, sometimes up to an hour before the time they were told. And this has all been documented by the DEA and Chicago Police Department both. And the users line up, and at the hour that they were told, the dealers that want to establish the corner show up and they give the drug away. And they give the drug away, and it's a very good purity. It's a nice, even high from what the users tell us. So then they get their packaging, whether it be the Batman logo or a certain color baggie. And so what the word on the street then passes, hey, go over there and get the Batman. The Batman stuff is the bomb, okay? So after they get their clientele, then they start lowering the purity. So they have to buy more, the addict has to buy more in order to get that same first high. So it's not necessarily by design that they're throwing the 83% pure substance on the market. That is more or less, that's a mistake, because that takes away their profit margin.
I got to jump in. And because they just don't care. They don't care about any other human being. They care about their profit. That's all they care about. They don't care who they're killing, who they're addicting. They really just don't care. They're lowlifes. There's one place we should put them. If we have to build more prisons, we have to get the people selling the poison in our community off our streets. If there's 175 next year, let's shoot for there's only 100 next year. And the year after that, cut it in half again. We'll keep going until we win.
Is this on TV now, or will it be on Channel 6 sometime?
It is being taped, and it will be on Channel 6, yes.
Hello. I was wondering, I'm going to show my ignorance of drugs, but what can you put it in like a drink that people that don't care about people and they're like, oh, I'm tired of these goody two shoes, I'm going to show them and get them addicted to something. Does whatever, you know what I mean? I know, like when you can put the different date rape drugs and stuff, can they put it in there that the person that drinks it ignorantly could get addicted to it? Like, I'm going to show them because I'm tired of how good they are, because people are mean that way, kids in high school and junior high. I was just wondering, is that something that's feasible, or does that not happen?
Actually, I hear from kids and parents all the time, but they were tricked. It's not uncommon for somebody, like my son told me, somebody at work gave him a ride home and he said, here, try this, and handed him a makeshift pipe. Billy told me, he said, I thought it was marijuana. It was heroin. That's all it took. But there's stories of sprinkling heroin onto marijuana and rolling it up in a joint, and kids are smoking it. They get this intense high. I mean, you can be introduced to the drug. There's others who thought, oh, I thought I was snorting cocaine, and it was actually heroin. And the problem becomes, and it's really hard to explain, I tell kids in high schools, the lucky ones are the ones who find the intense high really unnerving. They get sick, they vomit. They're the lucky ones. The ones who try it and like it, they're going to try it again. I mean, if you like cherry pie, when you go back to the restaurant, what do you order? Cherry pie. If you find something that you like and heroin's an incredible high, they're going to try it again, and they're smoking it and snorting it. In fact, that's a real important point, folks. When I was a young policeman in 1973, yes, I'm old, the purity was 4 to 7%, and they had to inject it with a needle. Nobody likes needles. I mean, do you know any child who doesn't fear the needle? Well, now this drug is so potent. It's coming across the border so plentiful. It's coming off. on average in the west side of Chicago at 20% purity. Kids can snort it and smoke it. If they like the high, they're going to try again. Another reason why I'm glad I'm here, education. Kids have to be, they're pretty smart. Tell them it's a different drug. You can smoke marijuana, okay, and it's not good, it's a bad decision. You can use heroin once and die. That's what kids have to be told about this terrible drug.
Hi, my question is, are District 58 and District 99 going to be part of the Robert Crown trial program?
No. No, they're not part of the pilot this year.
Any indication what the heroin use is at North or South? Is it here at all?
Scott, Mike?
In our community, yes, it is present here. Usually what we'll see is like I said, the age range from 18 to 25. So we'll see actually graduates, but I don't know that it's actually present in the high school, but it's usually more common for an age range for an 18 to 19-year-old for what we come across.
Hi, I know that when kids shoot up with heroin, they buy a big bag of syringes from Walmart or Walgreens. Is there anything that can be done to regulate that?
I guess so your question was, is there anything that can be done to regulate the sale of the syringes?
Right. When a person is using heroin, they will buy a bag of syringes.
They keep a law.
And they're just going to buy that to regulate law. So is that a difference?
There's laws.
There was a time when possession of a hypodermic syringe was against the law. When I was a young police officer, an unintended consequence, unfortunately, of the AIDS epidemic is that they now sell them without a prescription. You had to have a prescription at one time to get a hypodermic needle. So, I mean, another unintended consequence is because now they're available, kids start smoking and snorting. And then when they start building a tolerance and they want to find that high they got the first time, somebody will teach them or tell them, try injecting it. Why are so many kids dying? They don't know what they're doing. They don't know how to dose it. They take too much. Once it's in that vein, you're minutes away from nodding off and falling asleep and dying.
Just a quick question. Have you found any of it in the middle schools? And what's a good age to start having that conversation about education? What's a good age?
Well, I'll talk about the education. You need to start talking about kids with drugs and risk-taking in 4th grade. You need to start talking to your kids about lots of things early, and if you work up to those kind of tough conversations, it's easier. But you really need to start talking to them about how to make good decisions and risks, and them feeling uncomfortable in situations and how they handle that, and what healthy ways are to do that. We're teaching in middle school because it's important. I don't know if you guys have found any of the drugs there yet.
No. We don't have any evidence to show that there's any heroin use with that age group in Downers Grove.
I'd just like to comment on the parent that asked if heroin is in Downers North. It's in all of our high schools, and we have to step up and accept it. I'm a parent of a heroin addict. Thank God that they're alive today. So John, I appreciate you. Scott and Mike, you've been out to my home. You've helped me and many parents in this community. And I think we need to wake up and face the fact. I wish I had known this 2 years ago before this happened to my daughter. My daughter's 23 now. She started at the age of 21. I know children that are 23 now that started in Downers Grove North and Downers South when they were going to high school. So I just think it's important that we really wake up in all of these communities, Hinsdale, Burr Ridge, all of them. Like Naperville has done an outstanding job over the last year.
Thank you for being here.
I think somebody had made a comment about how vulnerable the young people are, especially in ninth grade when they're going into these big, like, kind of mega schools, 2,000 to 3,000. I think South's over 3, North's over 2. Is there any statistical analysis done on smaller high schools? If we had high schools at the 500 or 600 range, is there still that same amount of drug use, or are the kids more comfortable going into a 500 student high school that they're not feeling so vulnerable and not feeling so having to prove themselves as compared to being in a school with 2,000, 3,000, 4,000 kids and having to make their mark?
I think if you talk to the middle school and the high school teachers, you'll get a sense of what makes a good transition year. I don't think it makes any difference what size the high school is. I think it's a matter of how that transition occurs. So you can come from a very small elementary school even into a smaller, an upgrade to a middle school that maybe is a little bigger, but those kids are new to you. So you have new kids, and behaviors change and habits change. So, but I also think that these huge schools that we're building are extremely overwhelming. It's like a little city in some of the high schools, so it's hard.
I can comment that our partners in Southern Illinois and Central Illinois and Western Illinois, they have communities, they have high schools where kids have grown up with each other from preschool through high school, and they're traveling oftentimes 8 hours round trip to purchase heroin and go back to their communities.
I mentioned research. This is a really good example, and it comes back to what this gentleman talked about. There's still so much we don't know, and we have to study it. But one of my graduate students, originally from Wisconsin, I forgave him for being a Packer fan, but he told me he lives up in Dane County, which I looked on the map, around Madison. Small farming communities of 1,000 to 1,200, therefore small schools. I just saw the data. His brother's an EMT up there. There too, it's the leading cause of accidental death. It just exceeded traffic accidents. The numbers up there in those small farm communities of 1,000 to 1,200, it's exploding. It is an epidemic.
I just had a quick question on, Kathleen, I agree with you that our kids are smart, and to start educating them young. I'm a nurse for 18 years. My kids hear every patient I've ever come across is a drug patient. They hear it all, soup to nuts. My question for law enforcement is, and to dovetail out of the mother who commented about the Naperville system with their very strong heroin, making it very available, the information to the community is, the kids are stinking smart. They'll put their GPS cell phone in the mailbox of their friend's house, drive to the city, and come back. Those are the stories that I hear from my colleagues in Naperville. I'm wondering if law enforcement can comment on some of these. Sure, as a parent, we can search the rooms, we can look for the signs and symptoms in terms of how they look, but really this is happening. How is this happening? How do you get the call that your child is in the ER, or, it's gone far? And I don't think there's a parent in this room that would think that they are naive to what their children do. We all think we know what our kids are doing. But what have you guys found? How do you, in what you found with finding these heroin users, we need more. We need more hints, more clues, more strategies as parents. How do they hide it?
I can, without going into great detail, because we do have some kind of secrets of the business that I obviously don't want to put out here for the community. We have ways through law enforcement to track people through other means other than cell phones. We have constant communication with all the agencies in DuPage County and also Cook County, and the communication is getting better because everybody's starting to understand the problem. So we have more secretive means at our disposal. So to actually go through a list, I really wouldn't be comfortable doing that, other than, and I certainly wouldn't sit here and lecture anybody. As a parent of a 17-year-old, if I ping my son's phone, and I do it frequently, I call it, and he better answer it. That I would say is, as clever as you can be as a parent, then that's what I would suggest.
I'd like to comment on that, because the research that we did, the people we interviewed were either sober heroin addicts or heroin addicts that, and they're young, they were in their early 20s, so they had started as teenagers. And what they told us was that education, understanding what the drug was and what it could do to them, was probably the most important thing they could have known. And they also said that their mental health issues, the anxiety and the depression and the things that they're dealing with is the other thing that's going on. And so they're self-medicating, and we need to pay more attention to mental health in this country as well as in the schools. So I would think that pay attention when your kids say they're sad or they're depressed or those things. It requires a response, not just you're too young to do that. You know, I mean, it's tough.
To add, I guess, check on your kids in layers. You know, most kids have debit cards. Okay, every time they use a debit card, there's an address posted to it. You know, are they using a debit card in Hinsdale every day at the same time, or every Friday at the same time? You know, and then are they kind of falling off the grid for an hour and a half, consistent with what it would take to go from Hinsdale east on 88 to 290, what we term law enforcement calls heroin highway. You know, those, if you do it in layers, that will help you. Don't just take a one-prong approach, because we've tried that and it fails.
Hi. Within a substance as addictive as heroin, it kind of seems like the term overdose is almost a misnomer. Do you find that kids are using heroin and thinking that it's okay as long as they don't hit that point of overdose?
I don't think kids know what overdose means. I mean, they don't know what... Well, let me put it this way. When kids start using heroin, they're using it for the high. So they're not making a risk assessment. They're using it because it feels good and it makes them feel good. And what we're trying to do is educate them before they're in that position and give them real information that they believe, so that they'll understand that it will shut down your respiratory system and you have no way of knowing when that'll happen.
With respect to that, what we find in interviewing people is a kid will experiment for the first time. You know, maybe 5 or 10 of their friends will get together. Now, in my day, someone would steal a six-pack and we'd go to the park. You know, but today, 10 kids put their money together. The bravest one, or the type A personality of the group, drives down to the west side. And then they come out and they step on it. What we refer to as step-oning, which is they lower the purity of it, but give themselves more of a substance. So they can take $100, bring it back, double what they actually purchase, using common chemicals that are sold often in gas stations. And so they're first introduced to it with a very low purity. Then they fall in love with it, and then they start taking the trips to them by themselves. And they think, well, if I snorted, just as an example, a purity level of 13%, they expect the next batch to be 13%. But the problem is, if they go directly with the dealer, maybe it's higher. Maybe it's as high as that 98. Maybe it's that hot shot that's going to kill them.
Something else I think is important to know, as a young policeman, I call them secretive enclaves. Okay, they would get together in what was known as shooting galleries. Nobody could penetrate a heroin or a junkies community unless they were brought in, almost like vampires. I mean, that's real popular. My wife loves them, but you know, you don't get into the community unless you're brought in, and they would teach them how to do it. Back then, here's how you shoot, and they would show them how to cook it, how to inject it, how to dose it. Our kids out here in the suburbs have no clue about the power of this drug, how lethal it is, how to use it, how to dose it. Kids are teaching kids. I mean, these aren't bad kids. This is a really bad drug, and that's what's killing them.
Tonight I'd like to hear about the education of this drug to our kids in Downers Grove, and as the current president of the Rotary Club of Downers Grove, we just made a decision through funds that we received through Grove Fest, hosting Grove Fest in the community, that we're giving back funds to the community, that we've gone together with the Jay Calbray leadership team at both high schools to bring back a similar program that was called DARE, and they've made the decision to call it DECIDE. And through that, I would love to have Scott and Eddie sit down with these kids to discuss the heroin so that they can go out to those grade schools that they're taking their time for their late starts. That's when they're going and hitting every single grade school in this community. And these are great kids, and it's a great thing that they are doing when the funding was unable to be funded, when things got tight. So it's just something that is happening in this community, and I think it's encouraging that we have high school kids going back out with these young kids in the community, being role models. So.
That's the community doing something. Thank you.
We probably have time for just a couple more questions, and then we're going to have to wrap it up.
Can you all hear me? Okay. Keith Bullock again, the Student Assistance Coordinator at Downers North. We appreciate you being here tonight for sure. I did want to also speak to the fact that that the feeder schools also coordinate with the township staff, and that we have students going in to do peer teaching, high school students into both the middle schools and the elementary. And so in addition to the JCal Braid and the help with Rotary and Grove Fest, that we continue to do that work. And then through student assistance here in the high schools, both high schools, we continue to work in the area of prevention, education, and intervention. And I appreciate all the conversation about supporting students as they transition, supporting students in areas of mental health and social anxiety and making social connections. That's an area where we work really hard to help freshmen be comfortable and connected in the building right away. We hit them up very early with what are they going to be involved with here at school athletic-wise, what activities are they going to be involved in, where are they volunteering, how are they connecting with their family and their faith. We reach out to athletic parents and parents of those involved in activities. We provide other educational opportunities for the entire school during Red Ribbon, and then we also provide opportunities for kids to take ownership of this kind of leadership, these kinds of leadership opportunities and prevention opportunities through programs like Operation Snowball, which is a statewide program, and Students Against Destructive Decisions. And then finally, Kristen and I work with community providers on the treatment side as well, so that when there are students and families that are drug involved or are dealing with any kind of usage, then we can connect them to those agencies at a community level and then work collaboratively with them to support their overall health, their mental health, and any other substance use concerns. So if there are any other school questions too, we'll be glad to take those.
Hello, everyone. I lost my son August 7th of this year. He was 24 years old, and while he was in high school, I didn't have this opportunity to have this education, didn't really know about heroin. Thought it was like when I was young, reserved for hardcore inner city. I just never even met a heroin addict, and now through education and exposure, I just want to say that it could happen to your kids. My son was a great kid, a state championship football player, and had so much going for him, and I didn't see it coming. So just don't be afraid to talk to each other. Don't be embarrassed if your son has a problem. It's a disease like diabetic. Keep the dialogue going, and I commend this community.
Thank you very much for being here. Okay, at this point, we're going to conclude our forum. I want to thank all of you for taking time out of your day for being here, and for those of you sharing your stories with all of us. I would like to thank members of my staff that came out here tonight, also Deputy Chief Bluter, Public Education Manager Heinz, Mary Wennerstrom for helping put this event together, and also for our speakers for spending time with us tonight and for your inspiring words. Thank you very much, folks.